Well, I wouldn't say they're the furthest along. They've had 3 successful implants. Edwards has also had successful implants, and Tendyne is going to start in the fall. So I would say right now it's a horse race between Edwards, Neovasc, and Cardiac. The transapical approach, I think, is going to be the first one that will be approved. Is it really the most straightforward? The problem is that still requires a thoracotomy, and there is a fair amount of morbidity associated with the transapical procedure. The transeptal approach is one that is possible. The FDA has approved a multi-center IDE trial for us at Henry Ford to use the sapien valve in the mitral position for people with mitral stenosis. So there will be some attempts at using transeptal because it decreases the morbidity, but I think that in the mainstay, the vast majority of valves will be transapical. The next frontier is with mitral valve, and I think that that's going to be very important both in terms of products and companies. First, in terms of what's commercially available in the United States, the mitral clip made by Abbott. Now the biggest news is actually related to reimbursement. CMS is now giving them a technical upcode, and there's going to be a $15,000 increase in the DRG payment. That now makes the mitral clip product financially viable for hospitals. Previously, we were losing between $5,000 and $10,000 for every patient whom we treated with a mitral clip. Now it's going to be either neutral or slightly profitable. As a consequence, I think there's going to be a dramatic increase in the number of patients with mitral regurgitation that are treated in the United States with the mitral clip. And that's really the only commercially available product that's going to be available for American physicians for the next 3 to 5 years. Down the road, replaceable implantable mitral valves are going to be available. The people leading the pack are Edwards and Neovasc. Both of these companies now have survival from surgical implants in the transapical approach. Other companies, Cardiac has also had some survivors. Another company called Tendyne also is going to have implants starting this fall. So I think those are the 4 leading companies, but there are probably going to be many others. It's still a little early to know. There haven't been any valves that have been implanted from a transeptal approach yet, but I think within the next year or so we're going to see a number of trials started in Europe. The other interesting and important development has been that the FDA now wants to do first-in-man implants. So the FDA is actively negotiating with Neovasc, and it's very possible that they're going to be starting a first patient trial here in the United States within the next few months.